Hi, thank you guys so much for coming. I appreciate it. I'm going to give you just a little bit of background on Partnership for Success and a little bit of transparency. What I'm going to lean heavily into is the partnership part. I think that's why we were asked, I was asked to present, is to talk about how to develop partnerships. Throughout our time together today, I'm going to put several links into the chats to give you some contextual information. So I'm the Director of Partnership for Success, which is a collective impact backbone in Franklin County. So we have braided funding to support all programs who get funding from Jobs and Family Services, Children's Services, United Way, Adam H., and the City of Columbus, to support the academic, it's an equity-centered collective impact project to support the social, emotional, and academic outcomes for children. So all the work that we do is through the lens of equity. In particular, we've spent a lot of time focused on racial equity and socialized justice, social justice through the lens of anti-racism. So I'm going to share with you a resource. Often when people ask how you're doing in this tricky time, people can respond, "Oh, I'm fine." And in reality, often people are not fine. And so Resmaa Menakem offers these 3 questions, as a way to ask people to sort of do a little bit of self-reflection on how you're caring for yourself. I'm going to put these questions into chat and you can respond to them in chat. And he does quite a bit of work on racialized trauma and the ways that racialized trauma manifests in the body. And so if in the chat you want to do a little self-reflection and think about, how are you doing right now? How are you eating? How are you sleeping? And how are you moving your body as an indication of how you're doing? So I'm putting a couple resources from Resmaa. There's a podcast that if you're interested, if you're a podcast listener and you're interested in learning more about racialized trauma and the ways it manifests in the body, that's a sort of an introductory podcast. And then his book. Not well enough on all 3, Steve. I hear you. I think sometimes it can be hard in these really difficult times. All right. So feel free to continue to share those. We just have a short time together, but I think that could be a running conversation in terms of your reflecting on your self-care. The outcome for this training, or for this half an hour together, is to understand collective impact as a framework for partnership. I'm going to show you an example of what collective impact looks like in the way it worked when social emotional learning was at the center of it, and offer you the opportunity to think about it. In what ways might this look in your setting if mental health was centered? So we're going to a little background on collective impact, and this is the agenda for today. So if you could take a second. So we have the outcome, collective impact, and the agenda items in the half an hour we're together. So I'm going to start with just a brief overview of collective impact. We used for our work Stanford's collective impact model. I'm going to offer you a short article in the chat that you can look at. We took this model because we thought it offered a framework that wasn't overly constraining. It offered a framework that said, if you attend to these 5 things, if you pay attention to a common agenda, shared measurement systems, mutually reinforcing activities, have a system for continuous communication, and engage in this work a partner who can serve as a backbone agency, then you'll be likely to move people forward on a collaborative task. And so Partnership for Success served as the backbone agency in this body of work. So what a backbone agency looks like is it takes the role of doing the convening. It takes the role of getting all the people together. Who are all the stakeholders in this body of work that we need to have sitting at the table? How do we get those people to the table? How do we make sure that their voice is heard, that they're valued, and that they have a way of engaging in this work that allows them to maintain their autonomy and their mission of their organization, and also engage in some collaboration towards a common end? So what is true, particularly in work around youth services, work around child welfare and education, is that all the organizations that you're trying to get together don't often have the time or the human capital to be the convening organization. So meetings don't get called, notes don't get taken, the follow-ups don't happen. And so in collective work, collective impact work, it can be incredibly helpful to have a backbone support organization that has no agenda in the outcome, right? The agenda of the backbone agency is merely as a convener to bring people together. So we serve as the backbone agency to this collective impact in multiple settings. So we have a large community of practice that has over 50 providers and monthly meetings of over 100 people, youth service providers in Franklin County. What I'm going to share with you today, so Partnership for Success does that body of work, and I'll put that link back in there. So we are a large backbone agency that has several projects and convenes several partners across the county. I'm going to share with you just a small piece of work that we do alongside a site-based collective impact project, alongside a school and 7 community partners. So when you think about collective impact, if you think about it from a funding perspective, what we're talking about is if you have, so in this case, you have funders who fund out of school time programming. So they might fund City Year, Big Brothers and Big Sisters, Boys and Girls Club. They fund rec centers, they fund UMADOP, they fund Godman Guild, Gladden, Ethiopian Tewahedo Services. So the idea of a collective impact agency is that you can fund individual organizations and you get the impact from that single organization. If you also fund a collective impact organization that can get those groups to come together and coordinate and collaborate, then you get a magnified return on investment. You get a greater investment when you can get people to work collectively together to leverage their strengths towards a common end, right? So catalytic investment is what we ask for funders to support a collective impact agency. So the Windsor Youth Collaborative is a site-based collective impact initiative that's focused around 1 elementary school and 8 youth serving providers. So at the time that we were asked to support this agency or this school, they had 6 programs, 6 providers, youth service providers that were in the school. On any given day, up to 25 adults in the school who were not in-school educators, who were all working hard, but not necessarily working together. So the 6 of these providers were already partners in the Partnership for Success. Several of them came to us and said, hey, we got a lot of people in the building, but they're not really working together. Could you come and help us be more efficient and more effective in our collaboration? So I went and spoke to the principal and said, what's going on and what are you looking for? The principal, Windsor STEM Academy was at that time the lowest performing school in Columbus City Schools and had been for over 20 years. And so the principal it was her 20th year in the district, but it was her first year in that school. She had asked to be transferred to that school because she thought she could make a change. This was at the end of her first year. We had a relationship because I'd worked in Columbus City Schools for a long time. So I said to her, what's going on and what help do you need? She said, if you could get the providers, we've been doing a lot of trauma informed. I think that's helped with our climate and culture and the behaviors we're seeing in the school, but it's not making the changes we want to see in academic outcomes. So if you could get the providers to work together and be strategic around social emotional learning, I'm going to continue to work with the in-class educators around academic outcomes. So we did. So I said, all right. So I went and met with all the providers in that building and said, are you willing to work together? Are you willing to collaborate? I went and met with their CEOs and said, this is what we're trying to do. And they said, have at it. So in the first year, we spent a lot of time not working necessarily with classroom teachers and not working with direct service staff, but really working with the, what we call the middle management. From a systems change perspective, most change in systems can happen if you center your work on middle management who can both manage up and manage to direct service. So we focused our attention on site directors. We focused our attention on regional directors of organizations. If you're familiar with the Collaborative for Academic and Social Emotional Learning, they had their first annual social emotional learning exchange, and they've invited us to present at their exchange. And I'm going to put in here the link to the poster that's up on the screen. And this was our presentation in October 2019. At that point, we'd spent 1 year in the school. And in that first year, not working directly with teachers, a few professional development just to let them know what we were doing, not working direct with the direct service providers in the building, but just working in middle management alongside the school who were working on instructional strategies. In 1 year, the school moved from an F in achievement gap to a B in achievement gap in a single year. So the social emotional learning exchange asked us to talk about how did we do it? What were the things that were in play? How did partnerships get people working together towards a single outcome? And that's what we're going to talk about today. You'll notice if you have the, if you pull up the poster, at that time, Partnership for Success lived in an organization called Future Ready. We now live in an organization, we live in Franklin County Families and Children First Council, but we have a new email. So the email, if you're trying to contact, if you want some information, that's on the poster is not currently the email. So I put the new email, or if you look at the Partnership for Success website, you'll see our current emails in there if you're interested in getting more information. So looking at this poster, we're really just going to focus on this part, the approach. And I'm going to walk you through this with the knowledge that for our approach, social emotional learning lived at the center of our approach, and ask you to keep in your back of your head, what would it look like if mental health was at the center of this approach? So collective impact is about getting multiple stakeholders to agree that there is one thing that we can work together on. What's a problem of practice that exists in our community that we could wrap ourselves around, that we can work together and collaborate around? For us in this setting, it was SEL. It could also be mental health. So I'm going to give you examples of the ways that we engaged and the things that we did through this collective impact framework, knowing that SEL was our focus and asking you to put mental health in your focus and explore in your head and imagine what it could look like with mental health living at the center. So for us, in our approach, Future Ready served as the backbone organization, and our common agenda was social emotional learning. So we looked at CASEL's 5 competencies. CASEL is the foundational organization around social emotional learning. So all the work we do and all the tools we used are based on CASEL's model. The measurement tool we use for Partnership for Success is the DESA. The DESA actually measures 8 social emotional learning competencies. So that was the measurement tool that we used. I'm putting that information in there but I know the focus is mental health, so I'm not going to spend a lot of time doing that. So thinking about mental health in the chat, take a few minutes. And what meant, we use social emotional learning and we use the DESA as our organizing framework. So we use social emotional learning and mental health. Social emotional learning and the DESA framework for our common agenda. What might be a common agenda in the mental health? What mental health framework might serve as a common agenda in your field? So just put those in chat. What are some frameworks that you're thinking about, the partners with whom you work? What's a framework that you might be able to get everybody to collaborate around? Go ahead and take a minute and share those in the chat. Because I think the ideas that you have might offer other people ideas of things that they could use. Thinking about what might be some examples that you could get people to collaborate around. So I get a couple people put in ODE's SEL standards. ODE's SEL standards are based on these 5 competencies, on CASEL's 5 competencies. Accept, identify, move. So Julie, in your setting, AIM is something that the people in your study would have a common language around? ACE scores, nice. For trauma informed. There's a lot of intersections between mental health, trauma informed. ODE has made SEL in the 2019 to 2025 strategic plan, or 2024 strategic plan. SEL is one of 4 equally valued domains. So I try to think about trauma informed, SEL, and restorative practices as strands of a rope that we need to braid together in order to offer kids a guide to get from where they are to where they want to be. So I think there's a lot of ways to intersect, AJ, to your point. The one thing I'm wondering about with ACEs scores is ACEs scores might let us know what has happened to a kid, but maybe not let us know what their potential is. So whether that's a framework to decide these are some things that we're going to respond to, but certainly the resiliency factors associated with trauma informed might be a place to get people to wrap their mind around. All right, so we use SEL. So one of the areas you want to attend to as a group, one is making sure you have a backbone agency. The second is having a common agenda. And the third is a shared measurement. How might you, all the stakeholders, use a common measurement system to measure success? So for us, we use the DESA. We share data. All the organizations who worked with kids collected social emotional learning data. And we use that data to drive our programming. We use that data to inform all the decisions we were making as a group. So what does the data from Big Brothers and Big Sisters say? What does the data from City Years say? What is the data that the teachers have collected to say? From the rec center, from UMADA, from the YMCA, all those different programs who were working sometimes with the same kids. What does that data say, and how does that inform how we might work together? Where in your work around where in your work around mental health, what data frameworks might be available in the mental health setting for you? How might you collect data in a partnership setting? What might be some shared data measurement tools? Oh, nice. All right, so Kim, so one of the things we might need to do is find some additional resources for you around collecting data around mental health. Are there other people on the call who are in this room who have some suggestions for Kim around measurement systems for mental health? Panorama is a social emotional learning tool. So like DESA, Panorama is another tool. It offers, it collects data. That's a student survey. So Panorama offers the students' perceptions of their own mental health and their own social emotional strengths. DESA offers observational tools for both. So educators provide data, and DESA has just opened up a student survey in the high school. So those are two great tools. Promise is another tool. Thank you. Thanks, Carrie. And I'm not sure the other person, it looks like your email's in there, so I'm afraid to say your name. So some tools. Kim, if you stay on at the end of this, I can share some other tools with you. I don't have them in here, but I'll share a few other tools you might be able to look at. So once you've got a backbone agency, you've got a common agenda, something you're going to work together around, you've decided a measurement tool, then you have to say, all right, what can we work on together? What can all of us do together? So looking at the data for Wyland Park, or for the Windsor Youth Collaborative, we decided we really wanted to focus our attention initially in our first year around social awareness. The second year we looked at our data and we added self-management. So we took some really sort of basic tools, and one of the neurological models around self-awareness is that if you can help children, if you can help young people or adults increase their emotional intelligence, if you can help them learn to both identify and label their emotions, it reduces those emotions' physiological response in their body. So what we started to do was to ask all the adults in the building to speak to kids all during the day and help them, and to paraphrase their emotion and the feelings behind their emotions. So they'd say, oh, you're really excited because you guys are going on a field trip today, or you're a little anxious. So a Y Corps member who's walking a student home from school said, you're a little anxious because you know you got trouble in class today, and your mom, you're afraid the teachers, you're going to call your mom. Or you're sad today because your friend wasn't in school to have lunch with you. So helping students identify their emotions and the content, and giving them a more robust emotional vocabulary. That did two things. It helped the kids develop a more robust emotional vocabulary so they could better self-regulate. It also increased the social awareness of the adults who worked with kids, right? So we asked every adult in the building at least 5 times during the day to have a conversation with a child and be able to engage with them with this paraphrasing technique, right? Paraphrasing the emotion and the content. And so what happened is it created these environments where all the adults, if you imagine 25 adults plus all the teachers, having these conversations with kids and really listening with the intent to understand, really listening to understand their emotions, shifted their relationship and shifted the social awareness and the social awareness acuity of the adults and the self-awareness of the children. By, I think it was December, I got a call from the principal, and she said, I think it's working. And I said, what's working? She said, the mutual reinforcing activities are working. I was like, how do you know? She said, because I went out on bus duty and there was a kindergartner who was sobbing, and I couldn't figure out what was wrong with the kindergartner. And a 3rd grader walked up to me and said, she's anxious because she's never ridden the bus before. So that interaction let her know that not only were the kids developing that skill for themselves, but they were also using that skills to support each other. We asked all the stakeholders, so all the CEOs of the organizations that work there, the executive director of the school district, the rec department. I said, when you're visiting that school, go ask any adult in that building and say, tell me about a meaningful interaction you had with a child today. And they should be able to tell you of a conversation that they had with a child where they were able to paraphrase. So that allowed every provider, no matter if they were walking kids to school, if they were tutoring one-on-one, if they were the mentors from Big Brothers and Big Sisters and they came from Nationwide Insurance and they were working with that child, or if it was the rec department who came in and did recess and who had kids after school, all of those people in all of those different settings were all using this strategy to support mental health. There was also Nationwide Children's Hospital was using the PACS behavior, good behavior game. So we also wanted to leverage the expertise that was in the school. So we used our resources with Nationwide Children's Hospital and asked them to think about the ways that the work that they were doing could also be used. So we leveraged the experience in the building, and we also asked teachers to develop their own strategies. So this was a strategy developed by a kindergarten teacher. This was the way that she taught her kindergartners how to develop self-awareness about their behaviors. So all of these strategies, you want to honor the existing, you want to give people tools, you want to honor the expertise that lives in the building, and then you want to honor the expertise that is developing at the same time and sharing them with all the providers and all the people who are engaged in this work. We looked at our data. We made great increases in self-awareness, not so much in self-management. So we focused our next year on self-management. Take a second and think about what's something that everyone can do together that centers on mental health. So when you're thinking about mutually reinforcing activities, you have to be really mindful of developing activities alongside the partners and figuring out ways that they can be adapted in multiple settings. So how does it work for City Year? How does it work for Big Brothers and Big Sisters? How does it work for UMADOP? How does it work for the rec department? How does it work for Y-Corps? How does it work for teachers? How does it work for administrators? What are tools that everybody can use so that everybody's swimming in the same direction towards a common goal, right? So when you're thinking about strategies, make sure that the partners that you're working with are helping you co-create and co-develop strategies that work in their setting as well. We had multiple, so the fifth part of the framework that you have to attend to is how do you create ongoing and continuous communication? In this setting at the school, we had a leadership team, the principal, the vice principal, the social worker, myself and my data manager. We met bi-weekly. We had a separate bi-weekly meeting that was all the leadership of all the at that time, it was the 6 organizations involved in the work. So we had meetings with the leadership team to make sure that what was happening in the school and what was happening in with the providers, that we were making sure that we were on the same page and that we were collaborating. We had meetings with the people who were responsible for the work that was happening with the direct service staff, but we also brought together their CEOs. So quarterly, 3 times a year, we brought together the CEOs of each of those organizations, the executive directors from the school district, alongside with funding partners. So Nationwide Partnership, Nationwide Foundation, and Jobs and Family Services, Children's Services, UMADOP, all the people who were supporting those organizations. So how do you make sure that everybody's on the same page? You don't want to make more meetings. So how do you use existing communication structures that already exist so that you don't have to make more meetings? So we use site-based council meetings and we use team meetings to engage in that. So the question you ask yourself when you're walking away is, when you're looking at this through a site-based or through a collective impact lens, when you can get everybody swimming in the same direction, what might be possible? It's 12 o'clock. I appreciate your time. I know that was a lot of information. Feel free to send me an email if you have questions or comments. I'd be more than happy to help. And Kim, if you want to hold on, I'll try to share with you a few resources that might be helpful.